Okay, as a reminder, this session will be recorded and available on our website. Again, my name is Stephanie Lewis with the Center for Urban Transportation Research. I would like to introduce our speaker today, Ms. Diana Burns. Diana is a certified substance abuse program administrator who began her career in the field of substance abuse management as a senior account manager and as a medical review officer assistant with one of the nation's largest third-party administrators. For the past 11 years, Diana has been the project manager for the Florida Department of Transportation's Substance Abuse Management and Oversight and Technical Assistance Program. Administrator here at CUTR. Diana monitors transit agencies' compliance to drug and alcohol testing regulations, and she delivers training and has developed program implementation aids, training materials, and policies for agencies. Ms. Diana Burns is a lead instructor with the Transportation Safety Institute and has presented topics of substance abuse management at various national and regional conferences sponsored by the American Public Transportation Association, Transportation Research Board, the National Transit Institute, and the Federal Transit Administration. Okay, with that being said, I'm going to hand the presentation over to Diana.
Thank you, Stephanie, and welcome everyone. Today's topic is 5 ways to mitigate substance abuse in the transportation workplace. And it sounds to me like we had quite a few folks that are familiar with transit, so they may already have been kept abreast of the DOT drug and alcohol testing program. But I wanted to give you a little bit of a backstory on why we have the DOT drug and alcohol testing program in place. There were 2 fatal transportation events that occurred in 1987 and 1991. Some of you may remember these. In 1987, there was a Conrail locomotive and an Amtrak train collision that resulted in 16 deaths. It was discovered after a long investigation, and eventually the engineer and the brake admitted to using marijuana just before the accident occurred, which distracted them from taking safety precautions that would have prevented the derailment. So that was really the first time that we could tie prohibited drug use, illegal drug use, to a transportation event, a fatal transportation event. So that sort of brought the attention that was necessary to start the discussion about how this testing program would be formulated. While those discussions were going on and the Congress was debating over how this was going to happen, in 1991 there was another fatal event. It happened in a New York City subway. A subway motorman reported for duty in the overnight hours, and he was highly intoxicated, and he caused a derailment that killed 5 individuals. He left the scene of the accident and went up to street level and down the street and went to a bar. So when he was finally apprehended 13 hours after the initial event, after the accident, he said that he was intoxicated because he was so shaken up by the event that he felt the need to drink afterward. So those 2 events really did put a strong focus from a legislative standpoint on the need for some kind of a testing program to keep the traveling public safe. So it didn't take very long, from August of 91, which was the date of the event of that New York City subway derailment, to November of 1991, we enacted the Omnibus Transportation Employee Testing Act. And basically what that testing act did was it gave a directive to each transportation industry or mode of transportation, such as the airline industry, the railroad industry, transit, and federal motor carrier, which is the trucking industry primarily. It gave them a directive to start the discussion and the development of regulations specific to their industry. The USDOT as a whole began writing the rules on how the testing must be performed. So those were the events that led us to where we are today. And the DOT testing program, the initial reason for it, the intent of it, or the spirit of it, is to be a deterrent for safety-sensitive employees. not to use prohibited drugs or to misuse alcohol. So, we hope that by being an employer that does drug and alcohol testing, that it's well known that a substance abuser need not apply. So that's the first step, was to develop this program as a deterrent. And you keep in mind that we're testing only for illicit drugs. So those are drugs that are illegal to use, whether you're on duty or off duty. Many people that challenged these testing regulations when they were first developed back in the early 90s felt that they were an invasion of an individual's privacy. And the answer to that basically was, well, all of the drugs that are being tested for the most part, I should say, are illegal substances, and you have really no business taking them. The testing process, everything that is done from the collection and the analysis of the samples and all of that, follow federal guidelines. They are all designed and developed by the Substance Abuse Mental Health Safety Administration and the Department of Health and Human Services. So they're very highly regulated. And for transit, specifically the compliance to these testing program regulations is a condition of the receipt of federal funds. So it's important that employers understand what's required of them. So just to get kind of an overview here of our level of familiarity with the drug and alcohol testing program, if you would just take a moment to let us know whether you are very familiar, new to this, completely unfamiliar. Okay, it looks like we've got almost everybody in. Alrighty, so we've got about 50% of you that are very familiar with this testing program, which is great, and we have some that are completely unfamiliar. So that's great. I'm glad to be able to deliver some information to folks that are new to this, and it's an interesting topic. So for those of you that have a lot of familiarity, this will be, you probably are already aware of this, but just to get everybody on the same page, these are the prohibited drug classes that the Department of Transportation, the USDOT, is currently testing for. And I made mention in the previous slide there about them being illegal substances. There are some caveats to that, some exceptions. But you'll see in the amphetamines category, we're talking about methamphetamine, ecstasy. Those are illegal substances. Of course, cocaine and its derivative, crack cocaine, marijuana. As far as the federal government is concerned, regardless of what state you reside in, marijuana is considered an illegal substance, a Schedule I drug, and that's THC in any form. And in the opiates category, the testing program is looking for morphine, codeine, and heroin. There are some cases where some of those, such as morphine and codeine, could be legally prescribed, and in situations where that occurs, those results are reported as negatives given the opportunity to provide legitimate medical documentation. And then lastly, phencyclidine, or commonly referred to as PCP. So those are the drug classes that we are testing for under the DOT rule. But testing is really only part of the equation. In order to actually mitigate substance abuse in your workplace, just conducting testing in accordance with the regulation is probably not going to give you the results that you really want, which is to eradicate substance abuse in the workplace in order to keep everyone safe. So we've got these 5 things, as promised. I said 5 ways to mitigate substance abuse. That's the title of our session. So these are the 5 that we're going to be taking a closer look at. We'll go through each one individually. The first one is the awareness education. Many times I visit with employers who have a program, an education program. It's normally part of an orientation, a new employee, onboarding process. And the employees are given a lot of training on a lot of different topics all at once. And while that's meeting the minimum requirements under FTA rule, which is 60 minutes of training only one time while that employee is with your agency or your employer, while it's meeting that requirement, it's really not truly satisfying the spirit of the rule and the intent of the awareness education. So hopefully your program is it doesn't just stop at the entry level, that it continues and the conversation is ongoing. It should be focused on how drugs impact that individual's health, the safety of that individual, and the work environment, and how the impact of those drugs would be a danger to the workplace. And those messages, like I said, should not stop just at entry level. That should be a conversation that continues. So ongoing is the most effective. How can you do that? How can you keep that message alive? Well, you can add drug awareness as a short topic to safety meetings. Maybe the last 10 minutes of a safety meeting you spend discussing one of the prohibited drug classes. Maybe you take a current event, a news event that's related to substance abuse, and you highlight that in that safety meeting. Keeping the message alive through awareness posters that are maybe in your driver's lounge or a break room or over a time clock or even in restrooms. What I see very often when I visit with transit employers in particular is that they have some educational posters up, that say we are a drug-free workplace, or here's a hotline number to reach out for help should you need it. And that's great, but they haven't been changed in 10 years. So they are, a little corner is taken off because somebody needed to spit out their gum into it, or they're so yellowed from time that you can't even tell that they're there any longer. They become part of the wall. So changing those posters and that awareness informational material frequently helps to increase its visibility. A lot of employers don't realize that that's actually one of the requirements in the regulation, is to have some kind of distribution material, and a poster satisfies that. But changing it frequently will help to keep the visibility there. You can also do fun things like creating competitive games on the CUTR Substance Abuse Management website, which I'll be giving you a link to later on in this presentation. We've got a couple fun things there. We've got the Millionaire game, it's a PowerPoint, and the Jeopardy game that you can use to kind of make it engaging and make it entertaining. Obviously, a message, in order for it to be effective, has to be delivered in a way that is engaging. So I strongly encourage employers to, think out of the box. Okay, let's take a poll here again. Do you play a role in your employer's drug and alcohol testing program? And that role may be as a trainer, or that role may be as the actual program manager. So let's take a look and see how many of you are doing that. Okay, so looks like more than 2/3 of you actually do play a role in your employer's testing program. That's fantastic. And for those of you that don't, you're certainly getting a little insight into what's required of that program. So that's good. Okay, the second area that I want to talk about is the random testing program. I cannot stress enough that this is probably the single most important element of a compliant and also effective program. And the biggest, most important thing that you must achieve in order to have an effective random testing program is the sense that every time an employee reports for duty, regardless of what day of the week or what hour of the day, they should feel that they may be tested at that time. So the way that we accomplish that, of course, is to spread our random testing throughout all hours that we perform safety-sensitive functions. So, in other words, if you are a transportation employer that provides transportation on weekends, meaning you have drivers that are operators on weekends, then there should be testing on weekends. If you are a 24/7 organization, then there should be testing at 3 in the morning and 6 in the evening and 2 in the afternoon as well, because we want to cover all of the hours that safety-sensitive functions are being performed. That way, the message is clear to our safety-sensitive employees that any time that they come to work, regardless of what day or what time of the day, they could be pulled for testing, for random testing. Also, we want to make sure that no advance notice is given to the employee. And this includes nonverbal communication, which is an interesting aspect that a lot of employers don't realize. While they may have a secure system for, notifying a supervisor that one of their employees under their supervision is going to be sent for a random test, and they keep that information confidential until the time that that person is going to be sent for testing. While that happens very often, what we miss are the nonverbal cues that we're giving out. For example, I had an employer not too long ago that was doing testing on site using a mobile collector. And this collector, urine collector, specimen collector, would come to the agency, the employer's location, once every quarter. And what happened was the employees recognized that specimen collector's car. And so they knew that that was the day that someone was going to be tested. So they would start texting one another and saying, hey, today is drug testing day. And obviously, if anybody needed to stay home or turn around because they were afraid they wouldn't pass the test, that was giving them that clue that testing was going to be performed on that day. So keep that in mind. Nonverbal communication is just as important to be mindful of as would be you directly telling the employee. So no advance notice is critical. Also, DERs, which are designated employer representatives, those are the folks that are managing drug and alcohol testing programs for the employer and making sure that they are done in a compliant and effective way. They really need to understand the full process, the collection process, how things are analyzed. It's a little bit more than just managing the paperwork of the program. And I know that many of our transit systems here in Florida have learned that lesson, sadly, through audits. When they're audited by the Federal Transit Administration, and that's a random audit that they have, they'll learn very quickly that they didn't know as much as they thought they did. And it can be critical to the program if they aren't aware of all of the requirements. Okay, so the third one is eyes and ears, and I'm referring here to supervisors and others that are in a supervisory position, company officials. We have a training requirement in transit that supervisors must be given 2 hours minimum training, 60 minutes on the signs and symptoms of prohibited drug use, and 60 minutes of the signs and symptoms on possible alcohol misuse. And the reason that requirement is in place is so that we have folks that are the eyes and ears of your organization. In other words, they are trained to observe signs and symptoms in a safety-sensitive employee that may be caused by impairment from drug and alcohol use, drug and or alcohol use. And that's a really important piece in the program, because when we see upper level management may have training like this or be authorized to execute reasonable suspicion testing, those folks that are in administrative roles don't often have face-to-face communication with a lot of our operators or maintenance people or other safety-sensitive folks. So it's important that we designate officials, supervisors in our workplace that can be those eyes and ears for us. We also only have that requirement once while the supervisor is employed with you, which of course is a weakness. Refresher training is very critical to make sure that supervisors are constantly on the defense against substance abuse in the workplace, and that they understand that there is an important role that they play. The role-playing piece should be part of training so that employers can demonstrate to the supervisors what it might look like for them to execute a reasonable suspicion testing interview and referral, and giving them all of the other tools and information that they need. And what I mean here is the forms that need to be filled out and the logistics of the testing. You know, where do we take them? What if it's after hours? Who do we call? All of those tools are needed for them to be able to execute a reasonable suspicion test when they've witnessed impairment in an employee. And if they don't have those tools and they're not given that training, they're likely to look the other way because it seems like too much trouble. But if you're giving them the education, the training, and the tools in advance, then they will be able to execute what they need to do when the situation arises. It's also important that they are empowered. They need to understand that administration and upper-level management within your organization is going to support them. Unfortunately, years ago, I did some training for an agency in the state here, the state of Florida, and I heard from the supervisors that I was training that oftentimes when they would make observations of impairment and they would bring this to the attention of a higher authority, that basically, they would tell them, don't worry about it, we'll deal with it, and they would move on. And they weren't getting the support that they needed. They are your frontline supervisors, they're your eyes and ears. You need to back them up and support them. And when they bring to you situations where they have witnessed some kind of impairment, we need to stand behind them and allow them to do the job that we've trained them to do. And that goes right into the last bullet there, which is, giving them that culture for support, regardless of what the test results come in at. As I showed you previously on the slides, we're testing for those 5 drug classes, but there's a lot of other drugs, over-the-counter medications and prescribed medications that could cause the same kinds of impairment that those illicit drugs would cause. So, the test results may come back negative, but the idea is that the supervisors are stopping someone from performing safety-sensitive work when they see signs of impairment, and that is the most important thing. So treat your supervisors well, train them well, and support them. Okay, number 4 is oversight and monitoring. Many of you that have a role in the program probably already know that collection site security, meaning the location and the process for which we collect the urine specimen to be tested, is the weakest link in the testing process. It's unfortunate that the folks that do the actual collections, that have the job of collecting urine, unfortunately aren't paid very well for what they do. So there's a lot of turnover at the collection sites, and a lot of times they just kind of don't pay as much attention as they should. So you, as a program manager or someone involved in your employer's drug and alcohol testing program, you need to do routine inspections of those locations, looking for things such as bluing agent in the toilet. The contaminants and cleaning agents are removed from the area so that they could not be used to thwart the test by substituting or adulterating a urine specimen. And I honestly could spend an entire webcast on just that topic alone. So there's a lot there when we talk about collection site monitoring. But just in order to really have an effective program, you've got to have oversight for all aspects of the program, and this is just one of those. Also communicating with the collection site when you have delays in the employee's arrival. There's an entire cottage industry that has been developed for the sole purpose of beating a drug test. And if you were to Google or Bing or whatever your preferred search engine is, if you were to type in beat a drug test, you will see millions of hits within just a couple of moments, seconds really. And so there is a lot out there that is available to be purchased, devices that can be used, and all kinds of other things. So the delay from the time that the employee is told to go for testing and the time that they arrive at the actual testing facility or collection site is important for you to track, because you don't want them to have been given an opportunity to thwart the test by getting one of these adulterants or substitutions or contaminants. Right now, I will tell you that the single most critical thing that we are finding is synthetic urine. You can actually purchase synthetic urine online, and it is, for the most part, passing through the laboratories as a negative result. So that's a scary thing. So it's important that that you have eyes and ears and oversight on all these different areas. And then, of course, using a testing notification form is helpful in documenting things such as the time that the person was told to report and the time that they actually did arrive. So, okay, moving on to our last of the 5, which is self-reporting. And what we're talking about here is what kind of a culture you have. We talked other ways, mitigating substance abuse in the workplace. This one is about your culture, about your safety culture, about how your employees feel, whether you have an open door policy, whether you have an employee assistance program, and whether you have the culture that would allow them to report if they were to have substance abuse issues. This is talking not when they're called for testing, but when they realize themselves that maybe they're becoming addicted to their pain medication, or they're starting to drink more than usual, binge drinking, or whatever it might be. Do you have a self-reporting policy? Can they come to you, your employer, whomever it may be within your employer administration? Can they come and say, I have an issue with substance abuse. I'm concerned about whether or not I have an addiction to something. And this is really critical in that it sends the message to the employees that there's help for them, and that it's okay to report that, because the last thing that we would want to do is to have the culture that makes them feel as though they have to hide this, kind of like raising children, I guess, in a way. If they feel like they have to hide when they have an issue or dodge a test, that's not the culture that you want. You want them to feel as though they can come forward and that they can be given the help that they need, so that you get a safety-sensitive employee out of the workplace and into a program where they can get rehabilitated, rather than having them in the workplace impaired and just kind of hoping that they don't get called for a random test, or worse, using a method of thwarting the test should they be called. So self-reporting and having a policy on that is really critical in your overall culture within your workplace. So I strongly encourage you to develop, if you don't already have a program, to develop some kind of a program. Also, what are you doing for prescription and medication policies? Are they able to report to you when they're impaired because of a prescription or even an over-the-counter medication? Do you have a system in place that encourages that self-reporting rather than discourages it? And what I mean by that is, if they came to you and said, I'm reporting this medication use and I feel a little lightheaded when I take it, I don't think it's a good idea for me to be driving while I'm taking this. Do you have something else that they can fall back on, such as light duty service or a bank of hours that maybe they can draw from so that they won't lose pay? If we don't have a system in place like that, they're not going to come forward and say to you, I'm impaired today because I'm using Benadryl for my allergies. They're just going to muddle through, and of course that risks, the safety of the traveling public and them and everybody around them. So it's critical that we think ahead of these things, and that we have a culture that allows them to report, whether it's over-the-counter medication use or substance abuse, illegal drug abuse. So, and also the on-call impairment. Do you penalize someone who, let's say they're on call for the afternoon today, and they decided that they really didn't think they probably weren't going to get called in, so they opened beer and they drank, and when you call them to come in, are they penalized for saying, oh, I'm sorry, but I drank a beer at lunch, I didn't think you were going to call me in today, turns out you did, but I'm self-reporting that I can't take the shift. What's our feeling on that? Obviously, we don't want to encourage that to happen, but we certainly don't want to discourage them from reporting that as well. So those are things you need to take a look at within your culture and see what you can do to kind of help that along and progress that, so that there's encouraging factors for them to report their impairment, regardless of what it may be from. Okay, as you probably already know, I'm a big proponent of training. It's what I do for a living. It's what I feel is the most vital of all resources that you can be given. The Florida Department of Transportation is also in that same mindset that training is very critical. And they offer free training for Florida Transit Agency safety-sensitive employees. And that web address there, the HTTP, let me see if I can point to it for you. That one right there, sam.cutter.usf.edu. That's where you can find some training materials, and this can be used for those of you that are calling in and listening from out of the state of Florida. We share. We're a sharing state. We developed this material. It's all funded by FDOT, Florida Department of Transportation. It's developed here at CUTR, and we share it with every transit agency across the country. So we've got some really good resources available to you there. Some other resources for training material, the FTA website. If you're a transit agency employee, then you might want to take a look at their website and see what they have. They do a conference, national conference every year, and it's a great conference, and it's free. You just have to travel there. You've only got the travel expense. But it's a 2-day session, and it's really helpful for those of you that manage programs, manage drug and alcohol programs for FTA. And then the last one here is the Substance Abuse Mental Health Safety Administration, and they've got some great material in all sorts of forms, PowerPoints and posters and booklets and anything you could need related to this, to the prohibited drug classes and alcohol misuse. So if you're looking for items, as we said early on in the presentation, to change out, maybe you've got a poster in your break room that's been there since the dawn of time, you might want to take a look at this website and see if you can find some material. It's often free or very, very low cost. Sometimes just the shipping is all you pay for. So those are 3 good resources for you for some quality training. If you don't have a good in-house training program, there are plenty of folks out there. I'd be happy to, if you wanted to contact me privately, I'd be happy to give you some names of some national trainers that could provide some service to you. This is my contact information. That is my cell phone number. That cell phone number is provided by the Florida Department of Transportation. I am available 24 hours a day, 7 days a week to all Florida transit systems, and I'm also happy to take calls from those of you that are outside of the state of Florida. Should you ever find yourself in a sticky situation related to drug and alcohol testing, I'd be happy to answer your questions. And then lastly, there is my email address. I'm always happy to respond to questions via email as well. Okay. And so that does it for me and my slides.
Thank you, Diana, so much for the very interesting presentation. Before Diana takes a couple questions, I would like to remind you that you can ask her some questions using the Q&A manager located in the upper left-hand corner of your screen. Simply select the Q&A button, type in either your question or comment, click ask, and then I'll read those questions to Diana, and she'll be able to respond. I do have one question that came in, and it reads as apology as not transit related, but rather air travel related. Having recently seen for a second time the excellent film Flight with Denzel Washington, who played an alcoholic pilot who flew inebriated, how much more stringent are substance abuse programs for commercial pilots? Do you have any expertise in commercial pilots, Diana?
Oh, that's a great question. Yeah, I saw that film as well, and it was really intriguing. To answer your question, when I was talking about the USDOT and how there was rules for drug and alcohol testing, each industry developed specific rules of their own so that they would be, obviously more specific to that industry's nature. And so the same regulations that are followed by transit and federal motor carrier, which is our trucking industry, and the railroad, are also followed by FAA covered employees. And of course, airline pilots fall into that category. So there is a testing program, a very stringent testing program in place for airline pilots, for commercial airline pilots, and even those that are private pilots, if they're flying passenger planes, they too fall under that same rule. So yes, there are testing programs in place for commercial airline pilots, so you should be able to breathe a little bit easier next time you have to fly.
Okay, we have a question with the potential legalization of marijuana in Florida and other states. How does that impact CDL holders if they choose to use it?
That's another great question, and one that I'm hearing more and more often these days, given the direction that we're going in our country with marijuana use. Let me clear up one little bit of misconception. In the state of Florida, the type of marijuana they're looking to pass legislatively for medical use, for medicinal use, is a form of marijuana that's called Charlotte's Web, and it has very, very low THC levels in it, which THC is the part of marijuana that gives users the high, and it is being experimented with for seizures and other illnesses in small children. So that's the direction that we're kind of going here in Florida, is with that type of marijuana. Of course, on the heels of that, we will probably also see, recreational marijuana debate, increasing. But the answer to the question is that when you are a regulated employee, a DOT regulated employee, which a CDL holder would be, it will always be a prohibited substance. So even in the states like Washington and Colorado, where recreational use of marijuana is actually approved in that state, the folks that actually work in there as a DOT covered employee are prohibited from using THC products. So if they were tested under their employer's testing plan, it would be a positive test result, and there is no assertion of overturning that for medicinal use or otherwise. So on a federal level, it is still prohibited.
Okay. We have a couple other questions. It says, what is the protocol, or is there a protocol of transfer of confidential information from one department to another?
Oh, good one. Another good one. Yeah. This speaks to probably that random testing number 2, the bullet that we were talking about. Nothing in the regulation specifies how we transfer information other than to say that it is more or less, I'm paraphrasing, of course, but it's a need-to-know basis. So I have seen, unfortunately, times where the drug and alcohol program manager, the one who is given the list of randomly selected employees, there's between that individual and the actual employee, there might be 6 people that are given confidential information, and that's not something that would be a best practice. So reducing the number of people between the drug and alcohol program manager and the selected employee that know of the selected employee's random test, of course, would be the best practice. So if there's a way that you can develop it, I know some of the large transit systems have a hard time with this because of the shifts that they're doing 24 hours, 7 days a week operations. So it's difficult for there to be just 1 or 2 folks that are notified. But the more we can restrict the people that know of the random testing, the better. So you might want to take a look at that and see what you can do to minimize that. But there aren't any specific rules that address that.
And then another question that came in is, how often should you do a site inspection at a collection site?
Another good question. Well, the regulations, again, do not specify that you need to do any inspections, actually. However, if you are audited, if you undergo a federal audit, and this would be true of whether it's in aviation or rail industry, any of the industries, they are audited to see that they are compliant with the regulations. And when you undergo an audit for a drug and alcohol program, they actually look to see whether or not your collection sites, your facilities, are also compliant. And if they are not, that deficiency or non-compliance falls on the shoulders of the employer. So we say that inspecting the sites, of course, is a best practice, not a regulatory requirement. And my recommendation is, maybe a couple times a year, once, twice a year. More important than the actual inspections is the rapport that you develop with that collection site and the communication. So if you don't already have a system in place for communicating with your collection site, maybe if you just have a relationship with a collection site manager, that you can pop in and talk to them and, and just kind of inspect the place once or twice a year would be advantageous, if not more.
Okay. And then another question that came in is, I guess they're looking more specifically for some of the other ways that people are trying to beat the system or trip the test. How are people trying to get around that?
Another good one. Well, I did a session at the Safety Summit in June, and we talked a lot about this kind of thing. In addition to the synthetic urine, which is available online, there are also other types of adulterants and substitutions. And like I said, you can Google them and you'll see thousands that will come up. Most of them, the laboratories have caught on to. But what I often say is it's a cat and mouse game. So the cottage industry that has developed these products for the purpose of beating a drug test, they'll come up with an adulterant or a contaminant of some sort, and it'll work for a little while because the laboratories haven't caught on to it, and then the laboratories will figure out how to analyze for that specific substance, and of course they'll stop making that and they'll make something new. More often what we're seeing, in addition to those types of products that can be added to a urine specimen, we are seeing things that are there to bring in other kinds of clean urine. Like, I have to be delicate when I talk about this because it's a complicated topic, but oftentimes people will smuggle into the collection site someone else's clean urine. And they will try to use that. And of course, if you know a little bit about drug and alcohol testing, you know that when they collect a specimen, it has to be within a certain temperature range to show that it's, produced by the body. And so that's one of the issues that is often caught. But there are products out there that are designed to keep the temperature to keep the urine at the right temperature. And yeah, if you Google how to beat a drug test, you'd be amazed at what's out there.
Okay, another question. What is the transit agency's responsibility for monitoring the substance abuse programs of contracted vendors who provide purchase transportation?
Oh, that's another great question. You have just as much responsibility over their program if they're paid, if a vendor or contractor is paid through your funding sources that you receive, federal or state dollars. It could be state pass-through or it could be federal funds, 5311, 5307, 5309. If your contractors are paid through those funding sources, then you are responsible for their compliance. So you have to monitor their compliance just as though the feds monitor yours. Kind of, it trickles down, essentially. So you should be doing at least annual inspections of those vendors' programs, those contractors' programs, to ensure that they're up to speed. Also, anytime that you host or hold a training related to drug and alcohol program management, you should certainly include them in that. Everything that you do within your organization, they need to be doing within theirs, and you're responsible for ensuring that they do it.
Okay. Well, Diana, it doesn't look like we have any other questions for you today. I, again, would like to thank you very much for the very informative presentation on the ways to mitigate substance abuse. So with that being said, I'm going to thank all of you for attending today's CUTR Webcast. Please take a few seconds to fill out the evaluation that is on your screen. Again, I know there is a group of you that have more than one person in the room, so you can complete this survey multiple times. This presentation will be submitted for continuing maintenance credits through the AICP program. Again, I would like to thank you, and we will be back again in 2 weeks, and enjoy the rest of your day.